and Ranking Member Braun for holding this important subcommittee hearing. And I'm looking forward to working with this committee in the new year on the Farm Bill and so many other things. And as we know, the committee has authorized and passed bipartisan bills on child nutrition many, many times through many different administrations. So clearly this is going to be a priority of ours. So I have a bill with Senator Lummis from Wyoming to better integrate mental health promotion and education in schools. We know that the spike in food insecurity may impact not only the nutritional needs of our students, but also their mental health. Can you talk about that connection, Dr. Volt?
Well, I think for a lot of kids, they're living with horrible food insecurity, they're living with nutrition insecurity, and they're living in poverty. And that combination of factors clearly affects kids' mental health, it affects their physical health. And when you look at the data from WIC, you can see that not only do we see better nutrition intake by kids on WIC, you also see better academic performance. And I think that link of really trying to help the next generation get a better start so they're not susceptible to the same inequities of current adults is really important for us all to be thinking about.
Very good. A 2021 Minnesota Department of Health Workforce Report showed 80% of Minnesota's qualify as shortage areas for mental health professionals. We actually have the lowest unemployment rate in the country. 2 months ago, we had the lowest unemployment rate of any state in the country in the history of America. So we are down across the healthcare sector and manufacturing and the like. It's in some ways a good problem to have. There's good jobs out there, but it's also, especially in the healthcare area, becoming a real issue. It's one of the reasons I'm such a big proponent for immigration reform and for the Conrad 30 bill that I carry, which would allow people who are doing their residencies in the U.S. from other countries to stay. The Improving Mental Health and Wellness in Schools Act would help address these shortages. From your perspective, what else could be done to provide training and to get help in rural settings? Obviously, doing this, something we did in the pandemic, telecommuting and doing it via the Zoom and other platforms was helpful, but ideas on that front?
Well, I think more broadly, coming back to something Senator Braun said a few minutes ago, we spare no expense to treat disease once it happens, but we don't do nearly the same in terms of trying to prevent disease. And thinking more holistically about how we invest in people's well-being and both create incentives for them to have healthier choices, but also availability of services should they need them is really critical. The shortage in healthcare of mental health providers is really a crisis, but the larger question we have to ask ourselves is why do our kids need so much mental health services? You know, there seem to be real crises with anxiety, depression. What is causing that is really the question that we should be trying to answer.
Very good. Last question, just someone else on the panel can take it. According to the Centers for Disease Control, more than 42% of American adults, about 100 million people, had obesity issues before the pandemic. As we know, having just visited Mayo and talked to them about that, it's only upticked, I believe, since the pandemic. Nearly 3/4 of American adults have issues with weight. Roughly 1 in 5 kids have obesity. Furthermore, studies have estimated that nearly 2/3 of COVID hospitalizations are related to obesity and diabetes. What strategies can the committee consider as we move forward with nutrition programs to not only make up for lost ground during the pandemic, but to promote healthier lifestyles, healthier eating? Anyone want to take that? Except not Dr. Volpe, he answered everything.
Okay. Something that was frustrating for me in practice was that oftentimes the only weight loss programs you could enroll a patient in was the weight loss program that was associated with bariatric surgery. And so it was essentially a high-cost procedure that was subsidizing weight loss. And so it would be to uncouple that and provide or better fund deliberate weight loss programs that people could engage with.
Thank you. Anyone else? All right, thank you. Oh, Dr. Bold.
Yeah, I think, you know, and it was mentioned a couple times, I think, and one of the reasons why in the work we've done, we've provided food to the whole family is it really starts in the younger ages. And once you get to the point where you don't know how to, you don't have access to fresh foods and vegetables, you don't know how to cook fresh fruits and fresh fruits and vegetables, it ends up being a lifestyle change over time. So I think really targeting at the younger ages and trying to change it from the bottom up, I think is one place to focus.
Very good. Thank you. Thanks, everyone.
Thank you, Senator Klobuchar. Senator Bozeman.
Thank you, Mr. Chairman. Thank you for having this hearing.